There are 3 segments to the Associate Faculty Orientation. The first segment is the General Orientation. The second segment will be the Clinical Skills Lab and Simulation Lab Orientation. And then finally, the third segment will be this segment for the Clinical Faculty. Welcome. My name is Dr. Susan Knowles. As we know, nursing is a practiced profession, and I was really excited when I read Gaberson, Orman, and Schellenbarger's text when they stated that clinical teaching is more important than classroom teaching. What nursing students do in clinical practice is more important than what they can demonstrate in the classroom. Clinical learning provides a real-life experience and opportunities for transfer of knowledge to practical situations. These are quotes or paraphrases in part from their text. I couldn't have felt more vindicated when I read this. I've always known it. I've been both a part-time and full-time nursing instructor. So I'm not taking sides. I just know, and I think we probably all do in our hearts, and the students tell us in the literature that where they actually put the pieces together is in the clinical setting. That makes their clinical instructor so important. That's why we have this orientation as well as the Clinical Faculty Preparation course, which we'll talk just a little bit about in a few minutes. Patricia Benner, in her blog on her website, which is a brand new website, I'll talk about that at the end of the presentation as a resource, she states in her blog that students with little clinical experience need coaching, questioning, and comparisons with similar and dissimilar patients, and to experientially learn from the whole situation. She says that clinical teachers literally augment the inexperienced student's peripheral vision. So this is what we are supposed to do as clinical instructors. We're supposed to help those students broaden their horizons so that they're not so fixated on the immediate present situation, but that can imagine the next 8 hours, the next days, the next months for the patient's recovery or the patient's illness experience. So as a part of your preparation to get ready to teach students, you need to complete the orientation. There's 2 parts to the orientation. One is the college convocation, and the other part is the face-to-face portion on campus where we go over the policies and procedures, answer what-if type questions, talk a little bit about some scenarios, things that happen. You also need to get familiar with the agency if you're not already aware of where it is that you're going to be teaching. Some people already work on their units. Some people have been doing clinicals in the same unit for several years, but most recently we have a brand new medical center, so very few people have a lot of familiarity with that situation. And then over the years, as each year progresses, we have different agency requirements. So that's another part of the preparation, is getting the clinical faculty as well as the students prepared based on what the agencies require. And then to get you enrolled in the faculty preparation course. As I mentioned just a moment ago, there are several new instructors that will need to get oriented to Canyon Vista Medical Center. We also need to have everyone get on board with Cerner training at the agency, or if you're teaching in a different agency, if they are on the computer system, you may need to get familiar with that computerized system. FYI, in case you're not already prepared, these things that are listed on the slide, such as your immunizations, a photocopy of documentation of your immunizations for an MMR, varicella, hepatitis B, TB, a Tdap, the flu vaccine in the fall semester when it's available, drug screening. The policy states that all instructors must be drug screened within 3 months of employment, and then to have updated documents such as current Arizona license, a provider CPR card, as well as I just mentioned the TB. And then you need to keep a record of your continuing education because you may need to turn that in to your employee file for nursing. What is the faculty supposed to wear when they're teaching students? Well, here is the answer to that question. Generally speaking, it's a lab coat and your name tag from Cochise College. You also may need to have a name tag, or most likely need a name tag at some of the hospital facilities, not necessarily the long-term care facilities. And you need to have an appearance, that reflects similar restrictions to students. So Teresa Katke is pictured in this photo that's on the screen, and I think it's a good example of how faculty need to appear to students. We need to remember that students look to us as role models. And so it's very important that as a role model, we role model the appropriate appearance. It's very difficult to criticize their appearance if ours doesn't stand within the standard. So you can see that she's got a lab coat over her street clothes. She has short hair, so she doesn't need to have it tied back. But in general, a faculty member should have their hair somewhat restricted as well. Their fingernails need to be similar to the students, which means that if they do wear polish, it's clear. Very minimal jewelry, only a wedding set. Their shoes and socks need to be appropriate for the clinical area, so no open-toed shoes. And to have general supplies like a stethoscope, perhaps a hemostat, paper, pencil, watch, that kind of thing. Students need to understand that wearing the student uniform is both a privilege and it carries responsibilities. So they need to have a name tag, and as mentioned before, their fingernails need to be cut short, no fake fingernails. If they do have polish, which I don't agree with, but it is in the policy manual that they can wear clear polish, their hair needs to be pulled back and off their collar. So in the previous photo, you saw the student who had her hair in a ponytail, but she had it up off of her collar, and that is appropriate. Their name tags are a part of the uniform, and I think as nurses we would all agree with that. So any type of name tag that they are either given from a facility or the ones that they have from the school are not to be used except when they have permission to be in the healthcare facility. In other words, they're not to use either their uniform or their name tag to gain access to a healthcare facility when they don't have a legitimate reason to be there. Their supplies are listed in the policy manual, and you can review that. I thought it was interesting when I was looking for photos and clip art and that kind of thing to put together the presentation, and I came across a blog, a nursingtimes.net blog, and the student had written that phrase, appearance is really important if you want to be taken seriously. And I think that's important for students to realize too. Attendance in the clinical area is mandatory. If a student is going to be absent, they need to notify their clinical instructor prior, if at all possible, to when they're supposed to arrive, or as early as possible, whenever they realize they can't come. So it's important as a clinical faculty, when you put together your expectations for students, that you give them time frames in which they can reach you. So You probably don't want to be notified at 2 a.m. if a student is planning on not coming because they're up vomiting. But you may want to be notified at 5 a.m. or 5:30. It depends on, your own personal time frames, like when you get up or what you are doing. If they are unable to reach you, you need to give them some alternatives. And some of the alternatives are to contact the clinical coordinator and sometimes the clinical unit and let them know, to let the clinical unit know to leave you a message to notify you that they aren't able to come. Only if the student is in a particular situation, like an automobile accident, or they are unable to call, is it acceptable for someone else to call on their behalf. So they need to know that that is an expectation that you have, that they will be the one to notify. My experience has been that students have been very respectful of that rule, but occasionally, I've only had it a couple of times, where one of their classmates who may be their ride will notify me that X student is absent today, and I have to let that student know that that's not their responsibility. It's the student's responsibility to notify. So if this happens, there need to be repercussions. And that may be just sitting down and counseling the student. That may be bringing it to the attention of the clinical coordinator or the director or assistant director of the nursing program, especially if this becomes a habit. All clinicals must be made up. So it's important for the student to also notify the clinical coordinator so that the coordinator can coordinate the makeup time. Clinicals are really tight. So in order to find an open slot for this particular student to be placed with another group, if possible, then it does take a lot of coordination between everyone's schedule. So the student needs to let the clinical coordinator know as soon as possible. And depending on the coordinator and their requests, it can be either by email or most likely it should be in person. So I have a little scenario here. It's the second week of the clinical rotation. This is a student and she arrives 15 minutes late. She does not call you and let you know that she's late or that she has any difficulties. She doesn't call anyone. She doesn't call the clinical coordinator or the unit or anything like that. She just shows up. She looks like this and she says, "I overslept, sorry, so what's my assignment?" So as the clinical instructor, what would you do? And what would you say? So I encourage you to talk this over with your mentor and talk about a strategy on how you would handle this. When a student is absent, they need to make that clinical up, as I mentioned. There is a form, and I want you to take a look at that. It will probably be in your packet of materials. And it's called the Report of Alternate Clinical Experience. And currently, both the lab and the clinical instructors are sharing this form to communicate. And what happens is you fill the form out, and as the instructor that has a student making up with them, you want to communicate back to the primary instructor what the student has accomplished during their time and your assessment of the student. Now, the second reason, Melissa most likely has talked with you about it already. This is where you as the instructor can communicate to the clinical skills lab what type of skill that the student needs remediation with. And this is agreed upon by both the student and the clinical instructor. So it's not a secret about what it is that the student needs to remediate. And this is very helpful for the skills lab staff to know what is it that you're looking for and what does the student need from us. And then they will communicate back with you about the success or lack of success that the student is having with a particular skill. Because we are really, really